everyone to the third of our three-part training on putting public health evidence in action to prevent and control cancer. So this is how our training has been organized. We have been walking you through a 6-step process. And in our first training, we walked through understanding the problem and collecting data on the problem and establishing goals for improvement. In the second training, we walked through finding and selecting evidence-based interventions to help you meet your goals, and then briefly touched on adapting those evidence-based interventions. You'll note in the email that Mary sent out as a reminder for today that we taped both of those trainings and they are available for you to watch if you happen to miss them. Today, we are going to be talking about implementing those evidence-based interventions and developing a plan to evaluate their impact. So the objectives for today's training are to talk about assessing your setting's readiness to implement an EBI, developing an implementation plan, using communication strategies to engage key stakeholders, write evaluation questions, identify measurable outcomes related to aims, and collect reliable and valid performance data. So I'm going to talk about implementing EBIs, or evidence-based interventions, and then I'm going to turn it over to Mary, who's going to be talking about evaluating your impact. So last time we met in the last training, we talked about finding an evidence-based intervention, one that's been shown to be effective, but that's only part of the story. You also need to implement it well in order to get the desired positive outcomes. So we're going to talk a little bit about how, and a lot of this will be very familiar to you, but I think it's a helpful refresher to really think about being systematic and purposeful as you think about implementing something new in practice. So steps for effective implementation, and I'm going to walk through 4. We recommend that you establish an implementation team, that you assess your readiness to implement, you create an implementation plan, and communicate with your key stakeholders. So those are the 4 steps I'm going to walk through. So an implementation team can be as small as 2 people or 5 people. It can range in size. The important thing is to not try to go into this alone, to come up with others who can support and work with you on implementing a change in practice. And to establish the team, you need to think about who should be on the team, assign team roles, schedule a regular team meeting, and then engage key stakeholder support for the team. And so on the next slide, it shows you how a tool that we've given you in your handouts, which is a team charter that can be helpful at the start of a project to just get down on paper who's on the team, when you're going to meet, to document that you have leadership approval. So I'm going to walk you through each of the pieces of this team charter fairly quickly. And in all of our trainings, we've used the same example, which is the Flu Fit program. And this is an evidence-based intervention that has been shown to be effective at increasing colorectal cancer screening by distributing colorectal cancer screening test kits, which are called FIT kits, at the same time as you do a flu administration of flu shots. So just to orient you that that's the example we're going to be using throughout today. And so here on your charter, if you go to the next slide, I'm going to break it down. You first have your goal or aim statement and measurable objectives. And we talked about creating these during our first training, but they're really important also for thinking about implementation and also for thinking about evaluation, which Mary is going to be talking about. So here we have our SMART goal, which is by December 2022, 75% of our average risk patients will be up to date on their colorectal cancer screening with no disparities. And then we have measurable objectives, provide a fit testing kit and recommendation to at least 80% of patients, etc. Next slide. So now that you know what your goal is and your SMART objectives, you need to select the members of your team. And in this case, it's a clinic-based intervention. And I know a number of you are not working in clinics. And so clearly, who needs to be on your team is very specific to your project and your location. But for this intervention, your team members might include the team lead, being the quality improvement specialist for your clinic, the team recorder, the clinic manager, and other members of the team might be a clinic nurse and medical assistant. Then agree upon when and where the team is going to meet. And I recommend at least once a month meeting and getting it on the calendar. And even if something comes up that's a conflict, at least you have it on the calendar and you can reschedule it to another time during the week, but at least you have it on the calendar. And then also identify key stakeholders. Who do you need to keep engaged? That's another part of the charter, and we're going to talk more about key stakeholders in a minute. So the next step is to assess your readiness to implement. And again, in the handout, we've given you a checklist, and this is just to brainstorm and think through what are the kinds of things you might want to put in place, what we call pre-implementation, so before you implement something. So I've put some examples here that are also on the checklist that you have as your handouts. Thinking about does leadership know we're doing this and do they support it? And can we get them to formally endorse it? Do we know who the staff are who are going to deliver the intervention? Do we have plans for educating and supporting those staff and other staff? Is there any space or equipment? How are we going to recruit patients or community members to participate in this intervention? So it's just a way of thinking through and brainstorming the kind of things you're going to have to do before you even start actually implementing the program. So going through this readiness assessment for the Flu Fit program, at the end of it, you might identify, well, we really need to work on leadership support, and we need to start making a plan for educating and supporting staff and a plan for recruiting patients. The next step for implementation is to create an implementation plan. And so in making your plan, you can review your goals and objectives, review information about the evidence-based intervention. What do we know about what needs to happen for this intervention to be put into practice, and review your findings from your readiness to implement. Once you've done that, you can create an implementation plan, and this is all pretty straightforward. Make a list of the specific tasks that need to be completed, create a timeline, designate who is going to do what when. And again, we've given you a template for an implementation work plan that's in the handouts that Mary sent to you. And the next slide is an example of what that looks like. So here you have, to the left, you see the actions that need to be completed, and there's actions that need to be completed pre-implementation and then implementation. This is only part of a plan. It's not a complete plan. It's just to give you a sense of what it looks like. So for each of those actions, there's a due date and there's a person responsible. And the IT is for information technology person. So the first action is you need to create a system to flag patients due for screening in the electronic health record. You're going to try and get that done by April. And the person you're going to ask to do it is from information technology. You need to purchase your FIT kits, which are your colorectal cancer screening tests, and you want to get that done by July. And the person you're going to ask to do that is the clinic manager. And the implementation plan continues on from there. So the final is communicating with key stakeholders. And I think this is an area that we tend to not think about as much as we should. And so next slide is So out down there in the corner is a graphic that kind of shows how a lot of us live our lives. We have so many things to do. We are so busy all the time that it's really easy to lose track of any one thing. And so communicating with the people around you is really important so that they stay engaged with what you're trying to do, supportive, aware of what you're trying to do, and it doesn't just get lost in the mess of everything else that people have to get done. And what often happens with new interventions, and I'm sure you've seen that yourself, is right at the beginning, everybody's excited and they're all energized. And then over time, their attention slowly drifts to the other urgent things or the next new thing. And slowly you see that quality of implementation, there's a real danger that it will diminish over time and people will lose their enthusiasm. So really thinking about how you're going to communicate with the people that are central to your project to keep them engaged. And it doesn't have to be anything very complex. So next slide. These are some of the people you'll want to think about communicating with. Leadership who will promote and support your intervention, healthcare providers who may be referring their patients. And again, this is a clinic example, and a lot of you are not working, may not be working in clinics, but you would do your own thought process about who it is that you need to keep engaged. Co-workers who will be working with you, patients, and others. And so these are some simple strategies. You can schedule a one-to-one meeting. So for example, you might ask for 15 minutes on someone's schedule to just talk to them about the program. Post it on a bulletin board, include an article in your organization's newsletter, create a flyer, present a brief report at a staff meeting, even if it's like 3 or 4 minutes. It's an opportunity to bring people's attention back to this important project that you're working on. You can do more elaborate things like getting coverage in the newspaper. You can also post to social media. All of these are ways that you can communicate and raise awareness and keep people engaged in your project. So the final thing I want to say about implementation is in the second training, we provided you a list of resources. I believe that Mary sent that out again. A number of the websites we pointed you to, they provide you with information about evidence-based interventions, and often though that information includes materials that you can use for implementation. So sometimes it will include sample flyers or sample educational materials, or protocols or implementation plans, various materials that may be useful to you as you plan for the implementation. So I would encourage you to go and look at those websites for materials as you think about implementation. All right, that is the end of my section on implementation. I apologize for the binging on my computer. I should have taken care of that before I started presenting. But does anyone have any questions before Mary starts? All right, I'm going to turn it over to Mary.
Okay, thank you, Jennifer. So we're now going to talk about how you might go about evaluating the impact of the evidence-based intervention that you just learned how to implement in Jennifer's half. And we're going to continue with our flu fit example throughout this part of the training. So here are our 5 steps for evaluation. First, we're going to outline what you already know about your intervention, such as your program goals and aims, your measurable outcomes and activities. Then using that information, we're going to talk about how to write our evaluation questions. And in step 3, we'll talk about deciding what to measure to answer those questions. In step 4, we'll discuss gathering the evidence that you need for each measure. And last but not least, in step 5, we'll briefly discuss using and disseminating your findings. So the first step is to list your goal or aim statement, your activities, and your measurable outcomes. These items highlight what you set out to do when you're implementing your intervention, and therefore they're a good place to start when you're thinking about how you're going to evaluate your EBI on its implementation and its effectiveness. As Jennifer mentioned in her training, when we implement EBIs, those are two things that we're thinking about. It's also something we think about when we're evaluating. So here we have our flu-fit goal, which is to increase colorectal cancer screening rates. And we have a list of our activities that we do as part of the flu-fit intervention, starting with identifying eligible patients and moving through the process all the way down to communicating results to patients. In our implementation plan, we identified these measurable outcomes that you see on the slide, providing a fit kit to at least 80% of patients who are due, at least 75% of patients who receive a kit will return the kit by December 30th, and 100% of patients with positive results will get follow-up diagnostic testing. So the evaluation of this information that we just gathered falls into two different types of evaluation. One is called outcome evaluation, and one is called process evaluation. A process evaluation assesses the implementation process, which often involves documenting and monitoring your intervention activities. We also include what we call outputs, or maybe short-term metrics, in this first process evaluation category. Just to give you a brief example of what an output might be for that first activity, flag eligible patients, an output would just simply be the number of eligible patients flagged. So if you ever see a logic model, if you're familiar with that, you might see the term output. So I just wanted to briefly mention it. But then moving to an outcome evaluation, that's where you're going to assess more of your medium and long-term impact or effectiveness of your intervention. And so for our flu-fit intervention, we can evaluate its impact by measuring how well we can achieve our goal and measurable outcomes. So asking both types of questions for process and outcome evaluation is important, because an intervention can fail for two different reasons. It can fail because it was not effective in your population, or it can fail because it was not implemented fully or correctly. And so the only reason when you're doing an evaluation to determine why your intervention is failing, or even why it's succeeding, is to ask both types of these questions. So that moves us to our step 2, where, keeping in mind these two evaluation types, we're going to start to write our evaluation questions. And so for the process evaluation component, you may ask the following types of questions depending on your intervention. Things like, are all activities being implemented as planned? Is the intervention feasible and acceptable? Are you reaching patients, particularly those at greatest risk? And are you reaching other audiences, like maybe providers or policymakers? For the outcome evaluation, your questions will be a little bit different, and you might want to ask things like, do behavior or knowledge attitudes change? Do behavior, knowledge, or attitudes change? So that's getting at some of your more shorter or medium-term outcomes. Do cancer screening rates improve? And then some of your more distal outcomes might be, do cancer-related mortality decrease, or do disparities decrease? So these questions will vary for you depending on your intervention and what your activities and goals are in your intervention. But it's good to kind of keep in mind these two categories so that you cover both types of evaluation. So going back to our flu-fit intervention example, we might write an evaluation question based on each one of our activities. So here I have a few examples. Our first activity was distribute kits to patients. So we may ask simply, how many patients received fit kits? That would be one way that we can, by answering that question, we can evaluate how well we did that activity. And put in another way, you might ask what percentage of eligible patients received fit kits. My second example has the patients as the actor performing the activity instead of us. So here we have the patients returning the kits. For that activity, you may ask, how did patients perceive the fit return process? In the third example and the fourth example are a little bit similar to my first one, where we are asking about like how many distributed kits were returned in the third example. In the fourth example, you can see that I have multiple evaluation questions for one activity. So you don't always, it doesn't always have to be one activity and one question, but however many questions you need to measure that activity can be helpful. Okay, so in your third step, continuing kind of on the same, continuing on with our evaluation questions, you want to start to think about what you will measure to answer those questions that you wrote in that second step. So here again, I have some examples where I've pulled our evaluation questions from step 2 here on the left, in the left column. And then on the right, we start to write out what we'll need to know to measure and answer that question. So for what percentage of eligible people received the fit kits, you'll want to take the number of people who received kits and divide that by the number of eligible patients. For our second evaluation question, how did patients perceive the fit return process? We might measure that by patient-reported barriers, facilitators, or satisfaction with the process. And the rest of the examples are similar to the first one, where we need to identify our numerator and denominator and divide to come up with the rate. So those would be our performance measures that will go into our evaluation table. So now's your chance to give it a little bit of a try yourself. What data would you collect and measure to answer this evaluation question? What proportion of patients who receive fit kits are using the kits and returning them per instructions? Does anyone want to chime in off mute or in the chat if they have an idea? Or just take time to think on your own too, that's okay. Number of kits returned, number of kits that are able to be processed properly. Exactly. So yeah, we need to know the number of patients who return accurately completed kits, and then we're going to divide that by the number of patients who receive the fit kit with their flu shot in our flu fit example. In the next step, we're going to start to talk about how we'll find the data that we'll need to calculate these types of proportions or to measure our evaluation questions. But I have one more example for us to practice before we move to our fourth step. So how would you answer this question, and what data would you collect or measure? For what barriers are patients encountering to completing and returning the fit kit? And if you have an idea, let me know off mute or in the chat. Any ideas? For this one, you could simply measure the patient's perceived barriers simply by asking them, maybe in a survey or an interview, and we'll talk more about that in the next few slides. But I also wanted to show that this type of evaluation question is a good example that what you'll use to measure and answer your question isn't always going to be numbers. Sometimes it might be qualitative information that you might get from an interview or a survey. And in the chat, I see we are doing a survey on this right now. The common answers are cost, fear, and no ride. Yep. So that's a perfect example. They had their evaluation question. They conducted a survey to find the answer. And here now they know the answer to their question from the survey. So those are very common barriers we hear a lot to: cost, fear, and lack of transportation. Okay, so moving on then to our fourth step, which is gathering credible evidence. So now that you have your performance measures, you'll need to identify ways to collect data related to those measures. So the first step is always to see what is currently available by looking at the existing data. This is often one of the more feasible options. It's a good idea to talk with your stakeholders or team members to identify what data is already out there and being collected. For example, in a lot of the work we do, we're in clinics, so there may be data that's already in the EHR or in some tracking logs that the clinic uses that will be helpful for the evaluation. If there isn't anything that exists, you need to start thinking about creating your own or figuring out how to collect that data. So in the first module, we presented a variety of sources of existing data, and those are also all listed on the resource list I sent out again. You can look into those, and they may be useful for long-term evaluations, but they can be challenging to use for a more shorter-term one because they tend to be reported maybe only annually or even less frequently, so they might not be as current as you need them to be. So if there is no existing data available, or if it's not very current, you'll want to start collecting your own. And you may do that by looking at existing measurement tools. So you might be able to collect data using a survey that's already been used before, that's been validated, things like that, or creating new tracking logs. And we'll talk more about this. Oh, I'm sorry. All this goes into your data collection plan. And I'm sorry about my dog. Hopefully she'll be quiet. So here's our table again, and this is kind of becoming our data collection plan or evaluation plan as we build it up. So here, next to my performance measures, I've added another column for my data source. And this is really helpful to think through so that you can identify which data you already have to answer your questions or what data you might need to collect new. And so here in my example, I have like FitKit tracking logs that are often used for flu fit interventions that clinics may be able to implement or already implementing. For how did patients perceive the fit return process, that you may look to patient interviews that you might want to collect new, or you might be able to use the clinic's customer satisfaction survey that already exists if they ask the right questions. So this is a good exercise in determining where your data is going to come from and if you need to collect it new for your intervention or if you can use existing data. So next, you also want to start to think about the frequency in which the data should be collected, such as monthly or pre and post program, like I have in this table here. You also want to include who is responsible for collecting the data. And you may notice that this is looking kind of similar to the implementation plan. A lot of these concepts go into evaluation too. But one thing I want to mention, when you're writing your own plan, you can be a lot more specific and actually include people's names in your table rather than just their roles. And we have an evaluation plan template that we sent out to you with the rest of the resources today that you can use to make your own table like this. So I want to talk a little bit about collecting data. And we talked a lot already in the first session about sources of existing data. And so here are some examples listed, and these are also on that handout that I mentioned. And I talked a lot about this already, but this data may or may not be useful to you in your evaluation, depending on how current it is, but it's always a good place to start and see, before you reinvent the wheel. So depending on what exists, you may need to collect new data. And these are some different data collection methods. We also talked about these a lot in the first session, but you can use some of the same data collection methods for your initial assessment, like we talked about in the first session, and for your evaluation. So that's kind of why they're coming up again. And I'm going to talk about each one of these a little bit more in depth now. So tracking logs are a very straightforward method that you can use, especially for the process evaluation component. And you can simply create like an Excel spreadsheet or a paper log to track when a series of steps in a process are completed, and that can be really helpful to have for your evaluation. For like colorectal cancer screening, they use tracking logs a lot to track reminders, completion of screening, and referral for colonoscopy. And it's good to include things like the dates, the numbers, and who was involved in that step in your tracking log. And I'll mention again, these are all very clinic-based examples. That's where we do a lot of our work, but this will work with any kind of intervention that you're doing. If you think through the steps that you will need to track, you can create, a tracking log that will work for what you're doing. Surveys can also be used to collect process and/or outcome evaluation data. And here we give a couple examples of using surveys for process evaluation. You might mail or text surveys to patients to assess their satisfaction. This can be patients or anyone who is like the recipient of the intervention. You may also mail or email the clinic supervisors or the people implementing the intervention as a survey and ask, how new screening tests were, or in order to assess how new screening tests were implemented or how they perceived the process of implementing the intervention. So using surveys to collect outcome data can be more challenging because process data tells you whether an activity is happening, whether individuals were satisfied, and what barriers were encountered. So that's a little bit easier to get on a survey. But outcome data tells you whether a change actually took place at the level of individuals or groups of individuals. And so this is more challenging because you need to be able to claim that the individuals that you surveyed are actually representative of your overall sample and the people that you want to reach. And so also in the case with a pre-post test survey, you'll need to be able to claim that the individuals who took your pre-intervention survey are equivalent to those who were surveyed at the end. And another thing that's tricky with surveys for outcome data is that often response rates can be kind of low. It can be difficult to get enough people to take the survey, or your survey sample size might not be large enough to really talk about talk about the change. And another thing to think about is the people who are most likely to actually complete your survey tend to be the ones who have the time and the energy and probably interest in your topic to take the survey on. So as a result, they might not be as representative of the overall population that you're trying to reach. And especially they tend not to be representative of the ones who are most at risk, which is who we really want to reach. So that's all to say that surveys for outcome evaluation tend to be very difficult, but surveys can be helpful more for process evaluation. The other thing I have on my slide here is that respondents may not interpret questions as intended. This is a really big one. In research that we do at UNC, we often go through a testing process with our surveys to make sure that people are interpreting our questions the way we intend. And it may sound kind of simple, but even a really simple question like, tell me about your process for getting ready in the morning can be interpreted many different ways. Like getting ready in the morning might be different on a Saturday, it might be different on a Wednesday, getting ready for what? And so people might answer a question differently depending on how they interpret it, and they may not interpret it the way you thought they would. So just a bunch of things to think about when doing surveys, that they can be, like you might be better off just interviewing people or going to a meeting and talking with them. And so that's what I'm going to talk about next. Qualitative methods can also be used to collect new evaluation data. We talked a lot in the first session about interviews. but you also can conduct focus groups which are very similar to interviews. You just have more people at the table. But your qualitative methods can also be very simple, like going to stakeholder meetings. If you're working with hospitals, you might find out when their standing meeting is and ask if you can have, 5-10 minutes to talk with them during their meeting that's already scheduled. And that can be true with any group of people, not just hospital staff. But you'll want to, ask the staff about their experience delivering an intervention. And you'd also want to ask those who received the intervention for feedback on any barriers and facilitators. So this can be a really, really helpful tool for evaluation, is just having a conversation with the people who are implementing it and the people who are benefiting from the intervention. And lastly, I want to talk about observations, which is another form of data that you can collect for your evaluation. And observations tend to document activities and environments. So you might use a checklist or an audit form that walks you through what you're looking for when you do your observations. The other thing that's nice about observations is that you don't have to observe every site or every process that's happening within your intervention. You can collect data at a random sample of sites, and so it makes it a lot more feasible. Observation data can be used to assess the fidelity of intervention delivery, and by that we mean assessing whether or not the intervention was delivered the way you intended. So while you may have data from your checklist that shows that the activities were complete, you won't necessarily know if the activities were completed in the way you intended them to be completed without maybe spending a little bit of time observing the intervention happening in real life. So that's something to think about. Another form of observation might be an environmental scan. And that's one that we've used before in our studies, looking to distribute cancer kits from pharmacies. We would go to the pharmacy and have a checklist that we follow to just make note of what the pharmacy environment is like. So we would note things like whether or not they had a separate exam room where they could counsel a patient on getting their screening test. We might make note of how busy they were, how many pharmacists were working at the time, or if there was easy access like parking for patients to get to the pharmacy. So an environmental scan can be really helpful as well to kind of get a lay of the land for your evaluation or for your initial assessment. So a lot of these tools that we're talking about here can work in a lot of different parts of the process that we talk about as well. Okay, so step 5 of our evaluation, the last step, is to actually use and share your findings. So it's always good to think about how you're going to disseminate and share your findings from the start of your process. So that's something that we like to include in the beginning in our evaluation plan if we can. And it's also just important to note that it's really good practice to communicate your findings back to your stakeholders and the people that participated in your surveys or your interviews. It's really good to show them sort of that you were listening to what they said and that you were making changes based on the feedback that they gave you. And it can, it's really nice to thank them and let them know that they were heard. The evaluation findings, as I said, can be important for improving your intervention. So if you learned what was working or what wasn't working, you can make changes from there. The findings can also be used if you disseminate them beyond your team. They can be used by others who want to implement a similar EBI, so they can learn from your process. And the last thing I want to say is that it's good to think about your audience and the format that you'll use based on your audience when it comes to disseminating your findings. Maybe for some audience, they would prefer a narrative in a Word document. Others might want a nice, brief visual data brief that you could put together. Another nice thing to do is to put the evaluation data into like a PowerPoint presentation. And we find that to be a nice way to send the data back to our clinics, because they will then like to take that presentation and share it with like leaders at their clinic too. So it's a format that is easy for them to access. It's really visual, but they also can use it to share with others as well. So those are the 5 steps for evaluation. We have a little bit of time where if you have any questions about evaluation or implementation, you can ask them now. And then after that, I'll turn it over to Veronica to talk a bit more about the proposal.